Welcome. From the Colorado for Universal Healthcare Group. My name is Sara Wright, and you are on putting the pieces together an info and action session on HB 24-1075, analysis of a universal healthcare system. So, as I was saying, Colorado for Universal Healthcare is a 501c3 nonprofit, and we work to win simpler, guaranteed quality healthcare for all for life in Colorado and the US. We have an exciting lineup tonight aimed at getting you up to speed on a bill that's already moving through the Colorado legislature. To kick us off, I'd like to introduce Virginia Gebhart. Virginia is a retired pharmacist and the leader of a coalition of organizations working together to pass this bill. Analysis of Universal Healthcare Payment System, HB 24-1075. Virginia is one of two dynamic and effective volunteer legislative action leaders for Colorado for Universal Healthcare, and she's a member of our executive team. She's also president of Longmont Area Dems. Virginia.
Thanks, Sara. I'm honored to introduce Representative Karen McCormick. She is HD11 representative for Longmont, and she is our prime sponsor for this bill. Representative McCormick committed months ago to making this bill her #1 bill in the 2024 session, and she worked diligently to meet this goal. She has delivered by introducing this bill on opening day of the session. We're so thankful for her experience, her leadership, and dedication to passing this bill in this session. Representative McCormick, are you ready to speak?
I am ready, and I'm actually going to set my own timer because I know you wanted me to try to stick with 10 minutes. So I'm going to do my best. Thank you, Virginia. Thank you all who decided to come to this tonight. I'm going to give, many of you already know about the bill, what's in it, but some of you may not. So I will give a little bit of insight as to why I'm running this bill, why it's important to me, and where we are in the process. So this bill certainly almost made it through the General Assembly last year. Due to circumstances over in the Senate, got stuck in the log jam over there. So this year we've updated it, improved the bill, have it in the system earlier strategically to make sure that it does get through and not get hung up on the calendar. Many of you know about the results of House Bill 19-1176 from 2019, where the School of Public Health was tasked with analyzing healthcare delivery systems the way we're doing it now, a single payer payment system, and then a hybrid of those two to give us a kind of a high view of how a publicly financed healthcare payment system might benefit Colorado and also benefit the amount of, lower the amount of money that we're spending on these systems. And even that bill showed very strong evidence of significant savings in the cost of healthcare statewide. It showed improvement in coverage of people statewide, and also in health outcomes, which is really critical that we use outcomes as one of our measurements. So that bill and this one both explore, this one in particular, explores an alternative payment system. And I want to be really clear for folks that are trying to wrap their head around this idea. It's an alternative payment system, not an alternative healthcare delivery system. And so doctors in the system and nurses and hospitals will continue to deliver the care they do to the patient. This is all about what kind of payment model do we have. So the payment system to be analyzed would reimburse providers from a more streamlined, not non-for-profit source. So it will build on that bill from 2019, but it will dig deeper to answer many of the questions that not only I have, the legislative body has, but the people of Colorado deserve to know if we actually can do this sort of payment system, and if so, what would it look like? So the bill will take a draft, a piece of model legislation that models what a universal healthcare payment system, healthcare system would look like. So it's a draft model piece of legislation that needs to come from a nonprofit, as you all know, that prioritizes certain tenants or certain priorities. And I don't know if I'll go through all of those right now, but there are 10 things. Some of the biggest ones are that comprehensive medical care, hearing, vision, and mental health are all included. It will require decisions to be made by patients and their doctors or healthcare providers, not by some middle person that's making payment decisions. It will allow patients to choose amongst the healthcare providers that are in the system. It will provide comprehensive healthcare to all Colorado residents. So that means everybody. And it is funded by premiums that are determined based on an individual's ability to pay, kind of like how Medicare is scaled depending on how much money you're making. It will prohibit deductibles and copays and ensure fair drug and hospital prices and payment to providers and other things as well. So just to know that all of that sounds like a dream, right? I think it sounds like a dream, but we have to have data. We have to have modeling systems on all of this so that we can be assured that if a system like this were to come to pass, that it would have a strong foundation, it would hold up over time, and it would be able to do what we want it to do. Some of the questions that we need answered. And if you all have access to a copy of the bill, the data we need is outlined on pages 6, 7, and 8 of the bill. But some of the questions are, what would the cost estimates be of such a system on a more detailed level? What would the reimbursement rates be to providers? Because we need to be able to attract providers and hold on to providers, healthcare professionals in the system. So people need to be paid adequately and appropriately for the services that they're providing in the healthcare system. So we need to know, are we going to be able to attract doctors and nurses and all? What would the expenditures be per payer? What would our premiums look like? This is really important to me as a former business owner with my 24 employees, having to shop for their health insurance that I was paying for every year. Was really frustrating that I was between them and their health care. And then how would the cost per payer compare with the ability to pay? That's really important, that we're not burdening people and that we are paying our fair share. We want to dig into the hospital costs between these payment systems. And we want to make sure that we look at what the impact on healthcare facilities will be, what the impact on private health insurance companies will be, and also to take into account the Colorado Option Plan. And the School of Public Health is ready to tackle all of these questions. And we want to make sure that we keep in mind any impact on the cost and development of pharmaceuticals, new pharmaceuticals. We want to make sure we're not stifling innovation in any way. So I call this bill a follow-up homework assignment on what the Colorado School of Public Health did in 2019. They are enthusiastically ready and willing to accept this homework assignment and have been very helpful in the original bill from last year, 1209, and updating the bill moving forward. The bill also will contain a 25-member advisory task force. The members are outlined on pages 8 through 11. This is important to make sure that we have a panel of folks that are prepared from their backgrounds to advise the School of Public Health when there are questions or if there's guidance that needs to be shared with the people at the School of Public Health. So the voices and the people that are in the bill were also picked very intentionally for their ability to offer guidance and support and advice as needed. But it truly is the School of Public Health's job to do this analysis and all this modeling and come up with a report. The advisory task force is strictly advisory, so they have no vote on what the School of Public Health comes up with or what's in their report. So we'll get a really great data-driven report when this is all over. And as I said before, many of you and people that live in Longmont and across the state continue to ask, can Colorado do this sort of thing? Are we able to do it? And I think that the people of Colorado deserve those answers. We need to find a better way of paying for and covering more people for their health care. We're all about saving money, and I just think there's an incredible amount of waste in the system and overhead. But it's not about what I think or what you think. We want the data. We want to be able to show people, here's the proof. Here are the numbers. Here's the modeling. We can't assume we know the answers. We can't stand on that assumption. We really do need this data to move forward. I'm really excited about getting the answers to all these questions and super proud to be carrying this bill, which has not been assigned to committee yet because we are still waiting on the fiscal note. It's going to be a little different than last year because we're asking the School of Public Health to do a little bit more and perhaps giving them a little more time. And I have 10 seconds left. I'm done. Thank you very much.
Thank you so much, Representative McCormick. And then
Yes, thanks, Representative McCormick. Is it okay, Sarah, if I go ahead and introduce Andrea now?
that would be marvelous. Yes.
Okay. Thanks, Representative McCormick, and thanks for making time for us tonight to share what you've been up to and what we're all about with this bill. And now I'm honored to introduce Andrea Wilkins, who is our lobbyist and team lead on herding cats. She is so patient with us and so effective. I'm so thankful that we found her after following Senator Hawkes Lewis' advice last spring. She advised us that we need to hire a lobbyist, and I'm so glad we did. As I said, Andrea has been so patient and so kind. She has so many connections that are really paying off for us in endorsements and so forth. And she's really doing a great job. So Andrea, it's your turn.
Thank you, Virginia. It's great to be with all of you tonight. I'm really excited about this conversation and just very excited about this bill and the fact that we're seeing it introduced early. It's ready to go. We've got really a fantastic draft a bill document that has been developed really thoughtfully. Introduced early on in the session to account for, some of the crazy timelines and some of the log jams that do occur in the General Assembly, as Rep. McCormick mentioned. So we are really excited about the outlook here, and I'm excited to see what answers can be gathered through this study. But the only way that's going to happen is if the bill does pass. And so that's where all of you come in. Your advocacy on this issue is so important. It is just incredibly necessary, just absolutely critical for you all to make your voices heard to your representatives, the General Assembly more broadly as this bill starts to move through the process. And I'd like to share some of the tools that we've developed along the way to help you in those advocacy efforts and to help join the coalition to really throw support behind this bill so we can make sure that we get it over the finish line this year. I'm going to go ahead and share my screen because I do have a couple of documents that are available for you to access through the toolkit. And Sara, thank you for putting that link in the chat. The toolkit that I'm referring to is the Alliance toolkit that really is kind of the storage place for all of the advocacy documents and tools that we're using throughout this effort. And so I'll walk through a couple of those so you have a good sense of what's available to you. To start with, let's see. Are you all able to see the flyer here?
Yes.
Looks great.
Perfect. All right, so we have a little fact sheet here that provides some information on the bill. It really kind of hits on the high points, gives a little bit of context, some history, some information on why this study bill is really a necessary component to figure out where we stand and what the next steps could look like. So as you're reaching out to your networks and really, elevating awareness of the bill, trying to educate on it. This document hopefully will be very helpful to you in that effort. And you can kind of just see, we've got some statistics around the need. I don't think it's any secret, certainly not amongst this group, about the need for major reform to healthcare in Colorado. Access and affordability are such a concern. And you can see that really bears out in the numbers that we've got here in the toolkit flyer. So really just kind of intended to give some context and some rationale for, why we need to contemplate a different system, a different payment system, and how that could actually work. It kind of just gives a sense of, the fact that this is the logical next step, building on previous studies conducted by the Colorado School of Public Health. It will give us more in-depth answers to the questions that we need to figure out where we go to find those solutions that will help Coloradans access the healthcare they need, regardless of what part of the state they live in. So here's really just kind of our basic fact sheet. I will go ahead and switch to one that we're referring to as more of our business-oriented fact sheet. Hopefully with me changing tabs, you're all able to still see what I'm sharing here. But if you aren't, someone please yell at me. But this business-focused fact sheet just includes a bit of a personal story from Chip Bear with who's the owner of Bojo's Pizza. Just really kind of illustrating how difficult it can be for employers throughout Colorado, small business owners that really struggle to ensure that their employees have health insurance, to provide for them and ensure that their needs are met so they can be a productive part of the workforce. But it's really a struggle. The cost is just a challenge for everybody. And you can kind of see in his remarks here, just, what a frustration that really is. So as you're doing that outreach, we know that this message will really resonate with a lot of Coloradans, particularly those that, have either run their own business or currently doing so. Know small business owners and really kind of understand the conundrum that they're in. And so, this is really just intended to emphasize how getting the answers to these questions that will help guide us towards a solution and hopefully move us towards a universal healthcare payment system would be very valuable to the business community as well. I do want to note that both of these documents are available in English and Spanish, so we would encourage you to distribute both. We want to make sure that our message goes as far and wide as possible and that we're being very inclusive in our outreach. So note that there are some Spanish versions available to you. And then the next thing I want to show you is our endorsers list. And this looks slightly different because I'm the administrator of the list. So you're seeing, some responses up here that have come in that are available on my screen. It'll look a little different when you go in. It's going to be just the basic questions about, your name, contact information, the organization you represent, what kind of advocacy or lobbying assistance that you can provide, whether that be participating in coalition events such as this tonight, or reaching out into the community, participating in action alerts that we'll issue at timely points along the way, potentially providing testimony or written communication to your legislators. There's a whole host of ways that you can participate, and would really encourage, as you're reaching out to people, to ask them to formally endorse, because it's really important for us to be able to show that there's broad support for this measure throughout Colorado, that this is not just a metro area issue. It's not, an urban versus a suburban issue, a rural issue versus suburban. This is really a challenge that's facing Coloradans across the state. And then most importantly, well, maybe not most importantly, but one of the things that I do really want to emphasize, you can see that there's a section here where you can upload your organization's logo. That's really helpful to us in creating materials that help illustrate that broad support, organizational support throughout the state. So we would love to have our supporters' organizational logos that we can add to that endorsement list, and give policymakers and the public alike a quick view of what's, who is really behind this effort, so they understand how important this really is to their constituents. And then the last document that I want to show you, that's included in the toolkit, is just a little compilation that I've put together over the years that I kind of refer to as my useful links document. It's got all kinds of things that you can access, resources through the General Assembly site, but perhaps most importantly, there are links that you can follow to participate in the legislative hearings or the floor proceedings. So if you're not in a place where you can easily make it down to the Capitol and watch the proceedings live, you can very easily do that remotely. The Colorado legislature has made it extremely easy for people to participate throughout Colorado, and it's a great thing to take advantage of. Also extremely important is this link here that will allow you to sign up for remote testimony. You can submit written testimony or you can testify live, and you can do it all through that link. I think I'm about down to a minute, and as you can all probably tell, I'm struggling with a bit of a cough and cold, and I think I'm about at the end of my voice. So I'm gonna stop right there. I'm happy to answer questions through email or through the chat, or I'm always happy to schedule a call at a later point in time if I can assist. But thank you all.
Thank you, Andrea, and thank you for coming through, even though you're obviously struggling with a cold and cough. We really appreciate what you've done for us, and this has all been very helpful. And I'll explore some of what you were talking about a little bit more, but I just want to say thank you. Your years of experience, through that, you've really helped us keep organized, stay organized, and keep heading in the right direction together. So thank you very much for that. And so now it's my turn to talk about a couple of things. What I'm going to talk about for a few minutes, about 10 minutes here, is how to contact your legislator. Many of you on this Zoom are old hands at this, and you already know how to do it, but some people are new to this. And so I'd just like to go through a few things to show you how you can get started. And I'm going to share my screen so that I can look up some documents here. And I'm going to talk about two basic things here, talking about contacting your legislator. And there's two ways you can do it. You can do it through just reaching out to your legislator individually, or engaging in our Capital Contact campaign. And I'm going to try to find a couple of sample letters that, oh gosh,
Virginia, the link is actually in the chat to the letters if you wanted to click it from there.
Okay, well, I can't see my chat now that I'm in share the screen. Excuse me.
Okay.
Jeez. There, that's what I need to do. And so now I can find sample letters. There we go. Sample letters to legislators. And as I said, you can do this through finding your legislator through the Assembly website or through the Capital Contact Campaign. And Sara was kind enough to put together these two sample letters here. This top one, as you can see, and I will try to make it larger, is short and sweet. And she invites you to utilize this and download it and add your own personal story to the beginning of this letter and then close it out with this. And that's a very simple, short and sweet letter that you can send to your representative. And here's another longer letter that Jim Potter and Paula Noonan worked on together for the Capital Campaign. And I guess I could explain what the Capital Contact Campaign is. That's a platform where you start out with a letter like this, which introduces the subject and explains, provides a lot of talking points and so forth. And what we will do when this goes live, hopefully by the end of this week, we'll send you a link and you'll have access to this campaign and you'll see this letter come up first. And then you'll be invited to add your own story in to that. And we will bank these letters, these emails, and send them to the legislators at the appropriate time. Sometimes that will be to the committee here, just before the committee hearing, or maybe it will be before a floor vote. And so you're welcome to use either of these letters and copy and edit to your heart's desire. And let's see if I can, here we go. And the other thing I wanted to show you is how simple it is to get to finding your legislator if you don't know how to do that. And you simply go to the Colorado Assembly website, which you can see here. I've got this in my tabs, but you can see here, leg.colorado.gov, content committees is where we are. Just click on Find My Legislator. And very quickly, this comes up and you simply put your address in. This is my address, and very quickly comes up. This is my neighborhood, so I know I put the right address in. That's where I live. And you'll see here that my Senator is Sonia Hawkes Lewis, and my representative is Representative Kyle Brown. And you can click right here to send them an email right there. Or if you want to learn a little bit more about them, you can click here to go to their page on the website. So let's see. Get rid of that. And here I would like to show you, I'm in Andrea's toolkit. She showed you a lot of things in her toolkit. Here's another thing that you can find with more talking points. And I wanted to mention that besides reaching out to your legislator through email, through just sending them an email or our capital contact campaign, you can also do a letter to the editor. And we have some resources in there, which are some talking points that you may find interesting or that resonate with you that you can use to write a letter to the editor. And I'd like to point out in here that Gwen Unger from Durango, who is the president of Colorado Healthcare Coalition, would be willing to help you compose a letter to the editor. He's really good at doing that. And if you need a little help in composing a letter to the editor and how to get it published and so forth, he'd be happy to help you with that. And here are some talking points for different audiences too, that you might use. So that is that. And I'm wondering if anybody has any questions about the things I've said just now, if there's anything that I've been using jargon and it doesn't make sense to you. As I said, we hope to have this capital contact campaign going live by the end of this week. And that would be just in time for hopefully gathering emails to send to the first committee. We expect the first committee hearing to be as early as possibly January 30th or 31st or February 6th or 7th. So you do have time to think about these and reach out for help. I see Les Reitman had his hand up. Les, do you have a question?
Les,
Can you
me
hear
know.
me?
Yeah. We can hear you, Les.
How about that? Can you hear me?
Yes.
Yeah, what's your question?
The question is appointments, like that. That's sort of something that is always an option, but it sounds like we're trying to be streamlined and focused, and to try and make an appointment with the legislature now is probably, with the legislator, is probably more, kind of a heavy thing to do. So I'm just wondering if there is any situation where you would want an advocate to try and set up an appointment with their legislator, or if that would be counterproductive since we're doing all these other things.
No, that's always good. Are you going to be able to attend our Healthcare Day of Action on February 7th?
Oh, yes, that's a good spot to do it, I think. Yes.
In fact, at one of our next meetings, I'm going to ask Nathan Wilkes to talk about, he said there's kind of an art to getting that done. And I agree, he's right about that. So we'll talk about that at one of our meetings, which reminds me, as someone mentioned, Jim and I are leading the legislative action around this bill for Colorado Foundation for Universal Healthcare, and we've started a group called Alliance for Colorado Healthcare, which is an alliance of various groups working together who have been working on universal healthcare for years, and various individuals who've been involved in the movement for years, plus some brand newcomers. And I meet on Tuesday afternoons at 3. And it's generally the second and fourth Tuesday, but going forward for the next few weeks, it's going to be every Tuesday. And if you would like to be added to that email list, if you're not already on my email list for that meeting, I'd be happy to add you. So you could put your name in the chat right now if you're not already receiving that. And it's a good place. We have pretty far-reaching conversations and ask and answer a lot of questions, and we'll also, try to provide more support for reaching out to our legislators. And I think I've spent my time. So on to the next thing, Sarah.
Okay, before I remove your spotlight, Jeff Dolman had a question for
Oh.
you, Virginia. He says, I'm blessed with Senator Jaquez Lewis as my senator and Representative McCormick as my House rep. Yes, you are blessed, Jeff. Not sure about wasting their time with advocacy. How about being able to contact other senators and reps? After all, although I may not elect them, I am as affected by their votes. And so I am a real constituent to any advice on that. And I would just say first to Jeff that our Capital Contact campaign, as soon as it's live, you'll get the link to that and it will go to every legislator. Virginia, do you also have any advice for Jeff on his question?
I think you're right about that. That's effective. And Jeff, if you know folks in other districts, reach out to them and share with them what you're up to and why. And, share the resources that we've shared with you. And they can do the same thing. And I would encourage people to let other folks know that are just new to this, that, our representatives and senators really do appreciate hearing from us. They appreciate us coming down to testify. They appreciate, saying thank you for doing what you're doing. And so that's a good thing to share with people you're reaching out to urge them to take action.
That sounds good. And Judy Danielson mentioned that even if you have a supportive legislator, if you have a personal story that shows the need for this analysis bill, that's a good thing to share. So thanks for that. And Walter, I see your hand up and we are going to do 10 minutes of Q&A in just a second. So I see you and I will get right back to you. What I wanted to say for everyone is that 2 recent studies have shown that the majority of Coloradans are really hurting from our broken for-profit healthcare, health insurance dominated payment system, and that they want to see real change from the government on healthcare. And so this study, to get answers to Coloradans' questions and to really look in depth about what is possible for Colorado and what could work and what would work best, is so important to answering those questions and finding ways to move forward for our state. And so I hope that you will consider donating to the Colorado Foundation for Universal Health Care. Your contributions, especially when they're recurring and monthly, even when modest, they sustain our efforts toward winning simpler, guaranteed quality healthcare for all for life. And so thank you for attending, and please do consider a donation if that's something you can afford and feel comfortable with. The link to donate is in the chat. And so now I'm going to turn it back. We would really like to take a few questions now over the next 10 minutes. And then what we'll do is we're going to introduce Jim Potter along with Virginia. Virginia is the co-legislative action volunteer, and he's also on the bill writing committee, and Belle Semple, who's our board chair, is also on the bill writing committee. So they're going to join Virginia and Andrea in taking some questions. And we just wanted to do a few questions now, and then we'll wrap up our program. And at 7:30, we'll take as many questions as we can fit in to 25 minutes between 7:30 and about 7:55. So we've been asking you to put your questions in the chat in general. I would say, Nancy, were there any? Nancy, Catherine Reed is the author of the life-saving Monday morning update and has been monitoring the chat. Nancy, are there any questions pressing from the chat?
There's no questions I see at the moment, but I did want to mention Kate Elliott saying that you can get an app called 5 Calls for your phone, 5calls.org, which will connect you to your legislators. It sounds like something worth looking at.
Awesome. Thank you.
Mhm.
So Walt, do you want to ask your question?
Thanks, Sarah. My name's Walter Carpenter, and I'm the alien here because I'm calling in from Montpelier, Vermont. And I've been with Colorado since the 2016 Colorado campaign, and I've worked a lot on messaging. I worked with the letters to the editor and worked with Sara. I wanted to just refer to the talking points a little bit and maybe throw something for the future, because I just had a glance at them and I didn't really see them. But if a question comes up, well, Vermont failed, how is it going to work here? Something like that. What would the talking points be on that one? It's just something I'm thinking that might happen in the future.
Well,
You don't have to answer it now, really.
because I don't see any of the speakers raising their hand to answer that question. I'm going to say that Walter has suggested that this bill, this analysis bill, is what Vermont didn't do. And that this bill is kind of an answer to that. Do you think that we could work on a talking point together, Walt, for that?
Oh yeah, that was just a quick draft that I did at work in a meeting. So
Okay.
But I do want to play with that idea.
Sounds good. Judy Danielson asks if we could mention who will choose the advisory panel. Bill?
I could take that one. The leaders of the House and Senate, each of them will, and the assistant leaders will they'll make 4 of their appointments, and then the governor will make all the other appointments. We will have some ability to make suggestions of who we think would be good people, but they'll have the ultimate authority to make the appointments to the task force.
Thank you, Bill. So I first saw quite a few questions and I'm not seeing very many. Are there any other, can we recommend physicians to be on that board? Yes, we can. In fact, Representative McCormick, are you interested in taking that question by chance?
I can absolutely take that question. And I was also going to chime in on the first comment from the gentleman from Vermont. That's exactly why we need the bill. Yeah, we want to find out information to know if it would make it or not. So as far as the task force, I think someone has started a spreadsheet on potential people that you have in mind for each of these positions, of the like 21 or so positions that come from the public, so that even the administration, the governor's office takes consultation seriously on any bill that is forming an advisory or a task force, for us to make suggestions on people that would be good appointees. Doesn't mean that they'll get picked, but it goes a long way to know that there are people interested, that are willing to volunteer their time, that know what they're in for. And you all that have been working on this bill for so long in this space are more likely to know who those people are. So yes, we want to know if you have suggestions on any of those positions.
Thank you, Representative McCormick. And then there's another question from Joyce Richardson. Do we know where Governor Polis is on this bill, and concern about whether he would sign it? Is that also for you?
Yeah. Yeah, I'll take that one too. Yeah, the governor's office and his team have been aware of this bill, and the feedback that we're getting is there's general support there. And again, as I've shared with many of you, that this bill is a data collection bill. So it's really important that we recognize exactly what the bill policy is doing, and that we're not saying that we're implementing a universal health care payment system right now with this bill. So, but finding out the information, we're not getting any concerns or problems from the governor's office. And I believe there was even an event this summer where he spoke in support of this bill. But we continually keep checking back in because, you know, sometimes things change. So we look like we're in good shape there.
That's wonderful. Thank you, Representative McCormick. And in terms of Rebecca Daly's question about recommending physicians for I'm wondering about putting Virginia's email in. I mean, we have a Google Doc, but it's not, I don't have the link at my fingertips. Could I just put your email in, Virginia, to add
Yes.
recommendations for the task force? Okay. So
Are you talking about task force or are you talking about the testimony or both?
This is actually for the task force, wanting to recommend physicians for the task force.
Sure. Mm-hmm.
Okay, and then we have a question. Are there categories for panel members to fill to have various stakeholders represented? Yeah, so that's part of that bill language, right?
Yes, it's in the bill.
Yeah.
It's spelled out very clearly in the bill, but it's the second part of the bill.
If somebody, yeah, okay, so in the toolkit is the bill draft, and we can also, if someone would drop the actual bill link into the chat where it goes to the Colorado legislators. I looked in the toolkit, it wasn't there, and I see Judy Danielson's hand up. Judy. And I'm asking you to unmute.
I attended a Colorado Fiscal Institute briefing on the budget situation in the state. And I understand the state's budget does not have a lot of discretionary money this year, much unlike it did last year. It had a lot of federal money coming in, and that's not happening this year. Is there a chance that we could get the amount of money that is needed for this study? Thank you.
I'll answer that.
Okay.
We're all hoping so. We're gonna wait for the March economic forecast as well, so that when we address the budget, we will know kind of what's in that bucket of discretionary spending money available for our bills. We have purposely written into the bill the opportunity and availability of having outside money also pay for part of this analysis. So gifts, grants, and donations are going to be available. So one way or the other, if the fiscal note comes in much higher than we think, there's ways for us to strategize through the process and not let the price tag on this bill stop us. So we'll wait and see. The last year's fiscal note was at around $300,000, and we have heard from both appropriations committees that level would probably okay. It's just, you know, if it's we'll just have to see, but we're gonna find a way to cover it and not let the fiscal note be the thing that stops this bill.
Awesome. So there was one comment and one more question in the chat, and then we're going to go ahead and finish up our program and take more questions if we have them at the end. So the comment was that from Etowin of Louisville, if that's how you say your name, Representative Brown mentioned to me yesterday that the governor has run on Medicare for all, and the expectation is that he'll sign the bill. So that's great news. And then Eileen Moniak asks, are there opponents of this bill? Have we heard of opponents? And if so, what are their talking points? I don't know if that's for Representative McCormick or for Andrea.
I can take a stab at it.
Okay.
the biggest opponents are going to be the healthcare insurance plans because if this were to ever come to be, their purpose would go away. So, of course, when your whole existence is threatened, potentially, even just by studying an idea, it would be hard to get their support. And that, that's okay. We don't expect to win their support. That's going to be the biggest opponent. But knowing that that's not something we can necessarily win their support for, their points are to strengthen the ACA, strengthen the system that we have. Well, passing this bill doesn't preclude strengthening what we have either and making it more workable. That can continue if that's the focus. This bill really is to analyze another type of payment system. So, Andrea, if you have something to add, go right ahead.
Yeah, I'll just kind of echo that really. If you go through the reporting list on the Colorado Secretary of State's office to see lobbyist positions on the bill, there's quite a few that have been entered already in terms of, who's supporting, who's opposed, who's monitoring. And it's basically reflecting just what Rep. McCormick mentioned. Kaiser Permanente is reporting an opposed position. United Healthcare, Colorado Chamber of Commerce is another one that is opposing. I mean, on the upside, there's not a lot of formal opposition that's been reported up to this point. Most people are either supporting or monitoring the bill, and we're continuously doing outreach to try and educate and ensure that people actually understand what the bill is doing. Because as Rep. McCormick mentioned, it's not precluding improvements to the current system. There are still things that, people can do. This is, completely outside of it, attempt to get an answer about what this system could look like. Is it feasible? What that path forward would look like? But it's really kind of a separate issue from some of the interests that people have in other areas. So we'll just continue to educate on this and hopefully, gain support when people understand what it does.
Thank you so much. So we can take more questions later, but I did want to wrap up the program part because some people may need to go. So Virginia, do you want to talk a little bit about testifying?
Yes, and I will share my screen again. And we will get to
About 15 minutes, I'd say.
We'll get to a document that I've created again to help folks who are new to this and may wish to testify. And I will say that I've been working on rounding up testifiers, and thus far we have about 14 people who wish to testify live that day, whenever the committee hearing happens. And about half of them are going to be able to make it to the Capitol to testify, and about half are able to do it via Zoom. And that's what this is all about, is how to access that system for doing that. And also we have several people who have, very compelling stories that they want to share. Some are healthcare professionals, and they're just too busy. They can't make it. So they'll just be sending in written testimony. And it's really accessible to do. And that's what this document is all about. And I'll just go through a couple of these things and assure you that you don't have to remember the things that I'm telling you, that I'll just, like, for instance, I'm going to start right here and go through all of this, and further down, this document is like 3 pages long, and it shows the different ways you can participate. how to testify remotely, live during a hearing, how to submit written testimony, how to testify in person at the Capitol, and how to listen online. And I'll just click to it, and you'll see how easy it is to get around. And basically this document that I've shown you is just a recipe. It's to just follow the clicks and you'll get there. And you just start here with public testimony, and you'll see that this outlined box is here, which is expandable to learn in detail how to do these different ways of participating by testifying, and even how to listen. And I'm not going to go through all those details, but you certainly can, if you haven't before, to learn more and get more comfortable with all of this. And the meat of this is right down here at the very bottom. Can everybody see my cursor?
Yep.
And you can see that you can choose to testify in person, remotely via Zoom, or submit written testimony. And these are all important ways to participate. Being in person at the Capitol, of course, everyone will tell you has more impact, but remotely via Zoom is impactful as well. I did that a lot during COVID, of course. And if your schedule is too busy, you can just send in written testimony. And so I'm going to go to in person and just take you through how you choose, or how you find the committee that you need and the hearing item that you need. And the easiest way I've learned is to click this top item here by committee and hearing item. And you go here to select a committee, and we're going to be in the House Health and Human Services Committee. Select a meeting date and time. And well, let's look at this date and see if we've been scheduled. We know that's a possible date. And so then you've got the date there. So let's see. These are the bills that are scheduled, and we are not one of them yet. I suppose it's possible that we could be, but this is where you find out. And it's then, once it's been scheduled in committee, that you can actually go through and do all of this stuff to sign up. Until then, you can't. But let's just pretend that we're going to testify on that particular bill. And then you just see there's just a little menu here to fill in what you want to do, for and against, and your phone and contact information. And you put all that in, and then you click sign up. And once you do, you'll get a confirmation email that you've been signed up to testify. And here, I'm going to click on remotely via Zoom. Again, I'm going to choose by committee and hearing item, select a committee, select a meeting date and time. And here's one that says upon adjournment. And that means that it may, if things are just going swimmingly on the House floor that morning, it may start as early as 10, but it's generally later than that. And here again are the items listed. And you go through and fill this all out again. And the process after you do this, after you click submit, is that you'll get an email with further instructions on how to access the Zoom. And it's a little bit more involved, but once you've done it, it's pretty easy. And I'll be happy to help you with that. If you get confused after you've done that, you can just reach out to me and I'll be happy to help you. And then submitting written testimony. Go by committee hearing and item again. See, you're getting to be old hats at this already. And we'll select that. Whoops. And the difference here, once you fill out all this preliminary stuff, is
Wrong one. That was testifying remotely.
Did I hit the wrong one? Yep, I did. Thank you. Because it does submit written testimony. No, it came up by written remotely via Zoom. Maybe it's because of.
Maybe
how
after you
close-
submit.
Virginia, you have to put your name and everything in, and then it gives you the box or the upload information.
Oh,
See,
okay.
it took
Thanks,
you to the
Ingrid.
screen to fill in your personal information.
Well, it still comes up remotely via Zoom.
Well,
Well, I'll have to figure that out. So
Well, that
anyway,
doesn't usually happen.
Can I say something?
sure.
I think if it's only giving you that one option, they don't open the in-person sign up till like 24 hours ahead.
so that was, even though you had trouble with the written one, which we know that we would be able to figure out, that was really helpful, Virginia. Thank you so much. And I just want to, we are going to continue to do questions, and there's a couple in the chat. But before we do that, it's 7:34, so we've used up our hour, and I just want to thank all of you for being here. And specifically, I want to thank Representative McCormick for being such a stellar prime sponsor and introducing this bill as her first bill on the first day of the legislature. This is huge. And Andrea Wilkins, also, thank you, Andrea, for speaking and working while sick. And then just want to shout out the other co-sponsors of this bill in the House, Representative Andrew Bozenecker, and Senators Sonia Jaquez Lewis and Janice Marchman in the Senate. And thank you so much for being here. We will continue to take some questions right up until 5 of 8, but I just wanted to say thank you for everyone, including Virginia, for her hard work on this program, and all of the dedicated volunteers doing the work to make our healthcare dollars work for healthcare for Coloradans. So thank you. I'm going to remove my spotlight so we have a chance to say goodbye, and thank you to those folks who are leaving. And if you don't want to leave, that's great. A couple questions that I saw in the chat. Well, first of all, there was this statement from Atawin, no Chamber of Commerce has ever supported any progressive legislation anywhere. Sorry, it's funny. And then Judy Danielson asks if our organization endorses 1075, does that go on the Secretary of State list? No, I don't think so, Judy. That'll go on the list of endorsers with your logo, just like last year, that really pretty list of endorsers with, now I could be wrong. Andrea, am I wrong? Will it also go on the Secretary of State website?
No.
It only will end up on the Secretary of State's site if your organization employs a paid lobbyist that is specifically lobbying on this bill on your behalf.
I see.
So otherwise, as Sara was saying, it's really to, when you're submitting the logos and that sort of thing, that in and of itself is really just to show broad support, and it does not report anything to the Secretary of State.
Thank you, Representative Cormick. Left and helps thanks us all for advocacy. Are there any other questions? We've got some people who know this bill so well. If you want to ask anything at all, we'd love to hear it. And if you don't, that's okay too. there'll be other chances. Anyone else?
Well, maybe while people are thinking, I can just, there were some comments earlier about Kaiser. And I think Kaiser could do very well with a single not-for-profit system. And I think it would take away the unfortunate conflict of interest that they have of being both a provider and an insurance company. I think they would be much better set to, because they have an integrated way to provide healthcare, they'd be ahead of the game with the universal system to be provided integrated healthcare for people. And I say this as someone, I've had Kaiser coverage for over 40 years, and I really like the providers. My concern now that I'm on Medicare is that there are disincentives for good health care that Medicare Advantage has that speak to the conflict of interest that they have. But even I'm not surprised that they oppose, but I think actually they could end up not being an insurance company, being continue to be the great provider that they are.
I would also argue for against Kaiser as being such a great system too. I was on Kaiser for a while, and the first thing that they did was they required me to drive all the way to Colorado Springs. I could not even go to a pharmacy within 50 miles of where I lived. I had to drive 100 miles to Colorado Springs, and I had to drive there to see a provider. Then what they did is they removed themselves completely from Fremont County and dropped everyone on the Kaiser Permanente Advantage plan that lived in Fremont County. So you're always taking a chance with a Medicare Advantage plan, no matter what the name of it is. And so you have to be aware of that fact. It's a chancy proposition. They can drop you at any time. They can, require prior authorizations for care. They can limit their pharmaceuticals. There are all kinds of problems with these plans, which may sound good at the beginning, but once you run into trouble, then you're really in trouble, and it's difficult to switch back out again.
Thank you, Jim. So there's a comment from Dr. Maddie Jacobs, just a reminder that we can all do written and oral testimony to make sure it's in the record. I hope I understand what that's about, but I think it's a great reminder that if everyone on this call were to go ahead and at least send in a written testimony, that would be great. And we'll have a really efficient way to do that for you guys in about a week with our Capital Contact campaign. That would be huge. And Ingrid says the plans can draw providers in mid-coverage period as well as medications. My goodness. Well, this is why we're working so hard for an analysis of a universal healthcare payment system. So, yeah, if we start on the pain and the pain points, we could suffer much like we already are all night long. Jim, yeah. Oh, and Jim, Walter suggests that we put what you said about the Medicare Advantage plans in our talking points. I think that's a really good idea. And thanks, Kate. Says we've answered a lot of questions in the session for a newbie, so she's appreciative of that. So we have also the Vermont question could go in the talking points, so those are good. Anything else, y'all? Any questions? Well, really, was that a hand, Jim, and then it went away? Thank you, Suzanne. Good night.
Elaine.
I see Elaine.
Okay, Elaine.
Yeah, my question is, I know in the city, you can have someone else read your testimony. Is that an option at the state?
Yes.
For those of us that kind of stumble a bit, you know, get somebody that is really good at presenting and do it that way.
Yes, that's an option. I'm hoping to get someone who is a farmer on the south side of Longmont. He's really interested in testifying because he's very interested in this topic. And he's just a really busy guy. And I've reached out to him and I said, I'd be honored to read your testimony if you can't make it. So that is an option. And I know that someone did that last year in our first hearing. I just want to say one more thing about testifying or writing a letter, an email, is that you may wish to choose a talking point that resonates with you. If you do, tie it to a question that could be answered by the Colorado School of Public Health analysis. And I'll just give you an example of what I'm talking about. As a retired pharmacist, I would argue that pharmacists have been turned into glorified data entry technicians for corporate-run PBMs and insurance companies, leaving no time to interact with patients and answer questions about medication instead of questions about cost. I understand that doctors and nurses feel the same way. Would it be possible to lift this crushing administrative burden off the backs of pharmacists, doctors, and nurses and other healthcare professionals? Would it be helpful if we had a simpler, more efficient way to pay for healthcare? Can we do this at the state level in Colorado? Wouldn't it be great to know this kind of information? So that's the way to turn your talking points into questions. As Representative McCormick said, we don't want to impart that we think we know the answer. We want to implore the legislature to pass this bill so we get some answers and find out what we can do.
Judy Danielson has a question. Judy?
Oh, it was just a comment that you only get 3 minutes to testify. So you don't have to have a long story, but it can be very concise. And we need to use proper terminology as thank you, Madam Chair, and representatives, blah, 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 when you go in to address a committee.
Thanks, Judy, for pointing that out. On that document I shared, navigating the Colorado Assembly website, toward the bottom there, or in the document, there are bullet points that list just what you've been talking about in terms of the proper way to write, to address people, and the length and so forth, and kind of what you can expect in terms of waiting around and that sort of thing. So if you click through those bullet points, you'll get some good information on that. Thanks, Judy.
Yeah, thank you, Judy. And Kevin Caffrey writes that Medicare disadvantage plans have forced over 170 rural hospitals to close across the country. Kevin, if you would, I'm going to put I know there's been some really good articles about that issue. And so if you have a good source for that and want to just email it to me at the info at, then that would be a good one to add to the talking points as well. Thank you. So Virginia, the thing you said before the last thing you said was really powerful. I almost wish we could have just ended on it. Of course, we're still going though, and I don't remember exactly what you said, but it was awesome. The revenge of the hedge funds is the next opponent. Revenge on the hedge funds. Yeah.
Ingrid or Sara, regarding what I said, my suggested, example, it's in the a document that that I hope Andrea is going to put into her toolkit so that people have access to that. It's titled Representative McCormick's Testimony Guidelines, where she reiterates that we need to focus on this bill and not the bliss that we're awaiting with universal health care. But we need to realize that we need to ask and answer a lot of questions. And if it points in the right direction, we're ready to take this next step, but we're not there yet. And so anyway, that'll be hopefully in Andrea's toolkit soon.
Yeah, I'll get that in shortly. I was going to make a small addition, but
Good.
yeah, otherwise it'll be in there shortly.
Good.
Yeah, and I have a list of resources that'll be ready to send out to everyone who registers, including the link to the toolkit. And it'll include the link to the video of this event once it's live and linkable. So I might just take a day or two to send that out so that it's complete. And we'll look forward to that. And then there was a comment from Ingrid in the chat about mental health. And I think that that's a really important talking point, although maybe not for this bill, but when we get to the implementation bill, mental health as healthcare, as on parity with healthcare, as universally accessible, unlike now. Yeah, the lack of mental health coverage for people on regular plans and Medicare Advantage plans in terms of health insurance is horrific. And as part of many of the founders of Colorado Free Universal Healthcare are therapists for a reason, because all the denying of healthcare started with managed care in mental health. Judy Danielson says, when I tried to get off Medicare Advantage, I found my pre-existing conditions would raise the cost prohibitively. Yeah, these comments could be a little side document of talking points just on Medicare Disadvantage. Maybe we'll figure out how to do that. Okay, well, I think we're good. I think we're ready to pass a bill. And
Yes.
we'll all read Representative McCormick's recommendations for testifying, because we all know the bliss that awaits with universal healthcare, but we really want to focus on actually passing the bill at hand, which will answer questions first. So thanks, Marissa.
Thanks, everyone. I wanted to say I'm going to have my Tuesday afternoon meeting tomorrow, and the folks who wanted to be added to that email list, I'll add you. And so if you want to show up again and ask more questions or get more advice on how to testify, or let me know that you want to testify, as I say, I've reached out to a list of about 30 people, and we have about 14 who have definitely replied that yes, I will be available to speak, and either in live at the Capitol or not. And I'd like to hear from the rest of you who I reached out to confirm that. And if there are additional people who want us to testify, let me know.
Thank you, Virginia and Nancy and Bill and Andrea and everyone else who helped with this event. Oh, Lori says she would love to testify in person. Great, Lori, you would be amazing. Lori Heinzelman.
Oh,
Just
good.
get the time off work. Awesome. Thank you. All right. Good night, everybody. Stay well.
Good night.
Thank you.
Bye.
And thank you all
Thank you.
for very informative.
Thank you. Patricia, you have to end the meeting because you're the grand poobah.